Hi, I'm Dr. David Stoker, board-certified plastic surgeon in Los Angeles. A question my practice frequently receives is, what causes breast implants to ripple? That's a really good question, and it comes down to either the implant or the patient's body. The implants are not solid. A solid implant is something we might use on a male pectoral implant. If you did that on a female, the problem is you're going to feel like a dude, and that's very unpopular in my practice. So it's either saline or silicone gel implants. A saline implant is more liquidy, and it tends to ripple a lot more than silicone gel implants. Of the silicone gel variety, the more cohesive, or the more like a gummy bear the implants are, the less they're going to ripple. So the ideal balance to minimize rippling is to have a highly cohesive silicone gel implant that is thick and viscous, like a young, firm breast, but not hard and firm like a male bodybuilder's pectoralis majors might be. The second part of that question is the patient's body. If there's a thin amount of coverage over the implant, you tend to see the implant more. And because all breast implants ripple some, if you have thin coverage, such as a very skinny person with no breast tissue in an implant placed on top of the muscle, that's going to be high risk for seeing ripples. On the other hand, if you have a lot of breast tissue or a layer of fat covering the implant, and you put the implant underneath the pectoralis major muscle, it's a whole lot less likely that you'll see any rippling. If you'd like more information on the topic of what causes a breast implant to ripple, check out my website, drstoker.com. We've got a ton of information I wrote myself on there, as well as 10,000 beautiful before and after pictures for you to review.